go ahead and get logged in. Sometimes it takes a little bit longer with the technology. So my name's Kendall Nagy, and I am the director of the Meridian Anti-Drug Coalition, and I also do substance abuse prevention for the Meridian Police Department. And I welcome all of you to today's meeting and appreciate the fact that you've taken the time to log in and join us and continue your work with us or learn a little bit about what we do and get involved for the first time. So as we work our way through today's agenda, things are running a little bit slower via the GoToMeeting than in person, and so we might run a little bit over on time and not quite make it through the agenda, but my goal is to get through everything. And in trying to meet that goal, if you have any additions to the agenda, a lot of times we have stakeholders or partners that have updates that they'd like to share. If you want to go ahead and type that into the chat box, that will help me gauge. I have Sarah, the MADC secretary, watching that, and that will help me gauge my timing. And then, of course, if at any time there's technical difficulties or you're not getting your question answered, please reach out after the meeting and send me an email, and we'll make sure that we are squared away with that. So let's see here. Here is today's agenda, and it's a little different in that rather than having Cheryl go through and do introductions, I have a list that I can see, and if somebody called in, I just have you as a number. I don't have your name or the actual telephone number to refer to, but I'm going to go through and make sure that everybody gets a chance to introduce themselves so that we know who is here supporting our prevention efforts as we do this remotely. And then after I provide a few updates, we're going to hear from the different sector representatives representing 12 different sectors within our community. And those sector representatives also make up our executive committee. We just met prior to this. And so that's an opportunity for them to share some of the projects and things that they're working on, and then sometimes identify opportunities for additional general members, such as those involved in this meeting, to join in and learn about some of the things that we're doing and maybe help fill some of the gaps that we might have to implement some of those prevention strategies. And then just as a reminder that this meeting is being recorded, and we will have the recording available on the MADC website after the meeting. So welcome everybody, and we'll go ahead and get started. So for those of you that might not be as familiar with using GoToMeeting, I just have this little slide here to kind of show where you're looking and where the chat box is located and how it can be used on your screen. So that's just kind of a little tutorial, and you can put questions in there, comments, and if we don't address those during the meeting, then we'll be certain to reach out to you and follow up. So I'd like to jump in, and I have a few updates and things that I'd like to cover, and then I'm going to go through and we'll do the introductions, but again, I want to let everybody have a chance to log in. So one of the first things that I wanted to share was that we've been working on increasing the usage, the quality of the messaging, and the interaction that we have on social media. And there have been some conversations with the executive committee talking about perhaps adding another social media platform to what we already use. And it was decided that really we want to increase the quality of what's already existing, and that would be our Facebook page, before we would move forward with other platforms. And so I urge you to log on if you have a Facebook and check out the page and really think about different posts, different information, different target audiences that we can interact with using this platform. And email me ideas, share those with Cheryl and I, and we'll make sure that we consider that for posts and the type of education. We're working with our media sector rep, David, to develop some videos that can be used there as well. But really, I want to hear from you so that we have good representation from the community and how we can enhance what we're already doing as far as our Facebook page. Next up, I wanted to just kind of give an update on Telford Racing. So Zach Telford is racing with Meridian Speedway again, and he is our natural high liaison again this season. And while some of you might be thinking, well, what does that look like with our social distancing and the state of things right now? We have an opportunity to, he does a podcast, a tracks podcast, and we have an opportunity to partner with him and share some information about the coalition and the work that we do. And then along the lines of giving an update on events as well, and then events that Zach will be at and join us. In August, so far, unless there's a cancellation, we will have our Sparklight movie night. And then we will also be at the Meridian Speedway for the Eve of Destruction, where we hold our breathalyzer event. And so those are our next big upcoming annual events that are still planning to take place, and we'll have those partnerships as we have in the past. And so we're happy to say that Zach will be there at Sparklight Movie Night. You can see in that picture of the Facebook page, that's him there with his car, and we basically bring out everything that we have and set up, and it's a fun night, and it's a great opportunity for us to educate the public and interact with them in a fun, positive way. And we're super grateful to Wienhoff Drug Testing for them sponsoring us for the second year to be able to be at that movie night. And so we're really looking forward to that. And so while there's been a lot of differences in the way that we've done our prevention education over the last month or so, and we're headed into summer, which typically, you know, would be one of our busiest times of year, we are still getting the message out there and continuing on with our prevention, just kind of in new ways sometimes. So I wanted to reassure the coalition that there's still opportunities to volunteer at events, and we've got great things that we're looking forward to as we get back into the swing of things towards the end of summer. Another update that I wanted to share, and some of our partners, the Idaho Office of Drug Policy has a campaign called Be the Parents, and betheparents.org is their website. And in the last month, they've come out with, actually, I don't know that for a fact. I think that one of the resources is new, but they have a couple existing resources that really have come in handy while families and parents are home and children are home. And an opportunity to have prevention conversations. There's a 30-day parent challenge, and you can order it on their website. And it comes with a magnet, and you can kind of pin it up on the refrigerator, and it has a list of things for parents to do with youth. And then BSU has also partnered with Idaho Office of Drug Policy and Be the Parents, and they've come up with some interactive activity sheets. And so we're going to have a few of those and disseminate them at the YMCA, the Boys and Girls Club, and also the Meridian Food Bank and a couple other of our partners as we ease back into kind of the normal that we are also looking forward to. So I wanted to share those in case there are partners or stakeholders that you know of that could benefit from that resource as well. Does anybody have any questions regarding anything that I've covered so far before we open it up and go through and do introductions for the meeting? You should be able to unmute yourself. If anybody has any comments, I'll give it just a pause to see. I'm shaking my head. Sarah's in the office with me. We will not need to approve the minutes because the meeting was recorded last month, and it is posted on the website along with a chat log, which shows all the different things that were in the chat box and shared. So basically, GoToMeeting did that job for us. So those are available from last month's meeting, and we'll do the same thing for this meeting today. So no meeting minutes to approve. But good job, Sarah, noticing you're keeping up on your job. We appreciate it. So if there aren't any comments on the updates that I've provided thus far and the continuation of some of our partners and the resources, then we're going to go ahead and go through and do some introductions. You should be able to unmute yourself. I will call your name and we'll go through the list that I see on my computer so that we're not talking over each other. And I apologize. Like I said, we just had an executive committee meeting, and I apologize to Shawn and Nicole for skipping over you. It wasn't showing up in my list, but we'll definitely get through to you this meeting. So first we're going to start with Ann Roberts.
Hi, I'm Ann Little Roberts and had the privilege of volunteering when I was on the Meridian Chamber and just wanted to continue on. So I'm really excited to stay on as the business sector rep.
Great. Thank you for being with us, Ann. Next, we have Brenda.
Hi, I'm Brenda Wilson. I'm at Cottonwood Creek Behavioral Hospital, and I am hospital sector rep.
Thanks, Brenda. Next, I have caller 3, and I'm not sure who that is. They show that they're muted. I don't know if caller 3 sees on their screen that they're identified that way.
Am I caller 3?
You are. Who might we have?
I am? Okay, this is Bernie Walensky, Access Behavioral Health. I'm just kind of joining in to hear what's going on.
Excellent. Good to have you, Bernie.
Yeah, thanks.
Okay. And next up is caller 4. I show you as already unmuted.
Hi there, my name's Connor.
Hi, Connor.
Hi, I work for Ada County Juvenile Court Services. Just checking in to see how things are going.
Excellent. Happy to have you today. Thanks for taking the time to log in with us.
Of course.
All right, and caller 5. I see that you're unmuted. Okay, I'm going to move on. If we get that figured out, you can also put that into the chat box. So whomever you are, caller 5, we appreciate you joining us today. Next up, we have Cheryl. You should be able to unmute yourself and introduce yourself.
I'm Cheryl Mulvihill, Anti-Drug Coordinator for the Meridian Anti-Drug Coalition. Welcome, everyone.
Thank you, Cheryl. And Cole, you're next.
Hi, I'm Cole, and I'm the outgoing youth sector rep.
Thank you, Cole. Next, we have Courtney.
Hi, everyone. I'm Courtney Boyce from Central District Health. I do our drug overdose prevention program, and I'm excited to see what more I can do to contribute to this coalition.
Excellent. Thank you for joining us today, Courtney.
Thank you for having me.
Next, we have David.
Hi, everybody. My name is David, and I am the media sector rep, as well as the executive director for Community Coalitions of Idaho.
Excellent. Next, we have Earl. We're going to come back to Earl. Next, we have Esmeralda.
Hi everyone, this is Esmeralda Herrera with the Idaho Counter Drug Program, and I am with the Civil Operations Prevention part of our program, and I'm also on the Executive Committee with MADC as a Government Sector Rep.
Excellent, thank you. Next we have Jamie.
Hi, I'm Jamie Perry, and I'm the incoming youth representative.
Excellent. Thank you, Jamie. Next, we have Christy.
Hi, I'm Christy Lampy, and I'm with Children's Mental Health with Health and Welfare.
Thank you for joining us today. Milt, you're next.
I'm Mel Smith. I've recently relieved Mary Jones as a faith sector rep. Glad to be here.
Excellent. Thank you for joining us today, Milt. And Nicole, you're next.
I'm Nicole Harold with MADC, and I'm also a counselor at Calm Waters Counseling.
Thank you. And then I have ODP staff, which I'm guessing might be Camille based on communications recently. It looks like I need to send the audio pin is #98 to enable you to enter the meeting. My apologies on that one. I'm just getting a little note here. So the audio pin is #98. And we will, I can come back to you as well. Okay. And Earl, do you want to go ahead and introduce yourself?
Sorry, I had to take off there for a minute.
No worries.
I'm Earl Sharp. I work with Idaho State University Public Safety, and I am the Youth Services Representative. Been with MADC for quite a few years.
We appreciate the years of service. Thank you, Earl. Next, we have Rebecca.
Hi, everybody. This is my second meeting with you all. I am the new project coordinator with Central District Health for the Partnership for Success grant. So happy to be here. As I mentioned in the chat box, I'd also be happy to help you all with the Be the Parents campaign materials. If Kendall runs out of those, we'll be stocking up on combo cards and the magnet sets as well. And I'm just happy to be here and work on planning for the new fiscal year and partner up with you all.
Excellent. Thank you so much. We look forward to it as well. And Sarah?
I'm Sarah. I am the crime prevention specialist for the police department.
She's in the same office as me, so that was, sorry about the echo on that one. Next we have Shawn, please.
Hi, I'm Shawn Harper. I'm the law enforcement sector rep and also the lieutenant over the community services division here at Meridian PD. Thanks for having me.
Thank you. And Stephanie? I saw that you unmuted, but we didn't hear you. Stephanie Galbraith is, oh, go ahead. Do you want to try again? I see that you're unmuted, but your audio is not coming through. So Stephanie Galbraith is the Public Information Officer for the City of Meridian, representing the Meridian Police Department and the Meridian Fire Department. So thank you for joining us today, Stephanie. And then I just want to go back and give an opportunity to the ODP staff person. I see that you're muted. You should be able to unmute yourself and introduce yourself.
Can you hear me now?
Yes, we can hear you now.
Yes,
excellent.
There we go. Sorry. Yes, so my name is Camille McCashland. I work at the Office of Drug Policy. I work on the Partnership for Success grant, and just excited to see what you guys are up to and all the great things that are happening in Meridian.
Excellent. Thank you for joining us today, Camille. All right, I think I covered everyone. I apologize if I've missed anyone. I went through my list, and I'm thrilled to have everybody on the call today and appreciate that despite kind of trying to find workarounds to our monthly meeting, we've been able to carry on, and it's worked quite well thanks to all of you that are dedicated to our prevention efforts and make time to still come to the meetings and meet up and keep our prevention work moving forward. So the next thing that I would like to do is we'll go through some of the sector representatives. Some of them are new, and some of them have been a general member of the coalition, and some of them, like I said, are new to their sector representative role. So this is the first meeting where we're kind of going through and following the agenda, where they have an opportunity to talk about some of the projects and ways that they're involved with the coalition, and then also identify areas that we might need some help with. So I'd like to start off by introducing, hold on one second, I'm going to switch my slide, and you should see me. My husband always makes fun of me for not being able to do more than one thing at a time. I've got 3 screens going and my mouse is stuck. Hold on one sec. Here we go. So first off, I'd like to start by welcoming Ann Little-Roberts as our business sector rep. And for some of these new sector reps, I've already been in touch with them and we've begun to work on some prevention implementation and strategy planning. And so I'd like Ann to, and the other sector representatives that are new, I'd like you to introduce yourself, tell a little bit about why it is that you wanted to serve at kind of another level as a sector rep on the executive committee, and support the efforts of MADC. And then if we've begun to work on any strategy planning or implementation, you could share a little bit about that as well. So Ann, I'm going to turn it over to you to start.
Oh my gosh, Ann Little-Roberts, and having served for the last couple of years, I was just real excited to have an opportunity to stay on and continue to serve in hopefully an even greater capacity. I think that what MADC does is amazing and needed, and I've got a 20-year-old, and so I've really seen the last few years what drugs in our community can do and how lucky we are that we are diligent in trying to be on top of it, and just really want to be able to support that effort and the joint effort between MADC on the education end and the police on the enforcement end. Do I get to go into what we've been talking about?
Yeah, just kind of, I guess, kind of a teaser in that we're just getting the ball rolling, but Ann and I have been collaborating on sharing some resources and looking at some, considering some policy opportunities when it comes to cannabis and the state of Idaho. So Ann, if you want to just kind of, just a little update on what we've done so far, that'd be great.
Well, I think you said it best in our last meeting that Idaho is in a very interesting spot. Where we are regarding being one of the last states holding out, not supporting anything with medical marijuana, cannabis, hemp, just really sticking to our guns. And I think that we need to have some serious discussions about possibly putting forth some preemptive, a preemptive ordinance in Meridian. So Kendall and I started that discussion last week with a sit-down conversation, and hope to continue it and figure out what this committee would like to do.
Excellent. Yeah, I'm very excited about this. And if there's anyone on the call that's interested in being a part of that, you feel free to contact me offline if you have questions or would like to explore that further. And that goes with any of these projects and strategies that we're planning. And then, or go ahead and just share that on the chat box so that we can connect you with the right people to keep moving forward. So Ann, welcome. We appreciate your leadership and your involvement with the coalition, and I'm really excited about what kind of policy we might be able to work on. Thank you. So we currently have our civic and volunteer sector rep position open. So if that's something that you might be interested in or you'd like to learn more about, please shoot me an email, and I have an overview document that I can share with you to let you know some of the time commitment and expectation that comes along with that. And then moving on next to Esmeralda, she has been our sector rep last year and would like to give just kind of an update on what we're doing as far as her work with enhancing our evaluation measures.
Yeah, hi everybody. Like Kendall said, I've been working with her a little bit after the satisfaction survey last, was it last 2 months ago, right?
Yeah.
And just looking at some of the ways we can look at the coalition and the way it functions and how we can be more effective. Not saying anything towards the effectiveness of the coalition, but just I think the biggest picture with looking at process improvement is, as you as a member, if you're asking yourself, what's my role here? What am I doing? How do I fit in? That's the kind of feedback that helps that data or that process improvement, so that we can address that and look at how we can make you feel more included, more involved, or where you fit in. So those are just some of the things that we think about when we're doing process improvement.
Excellent. And so as we move forward together, Esmeralda and I will share some more communication and come up with a kind of a base plan to then communicate to the executive committee and then the general population of the coalition as well. And we'll move forward on then implementing those process improvements. So thank you for your continued involvement. Next, we have Brenda.
Kendall.
Oh, yes, I'm sorry.
Yeah, this is Mel. Hey, I got a question for you and Esmeralda as well, I guess. In looking at the criteria, it looks like she's involved in evaluation measures. And I was just curious as what elements, what type of things are we looking at when we consider measurements?
Sure, that's a really good question, especially since that can be such broad coverage. So in the past, there's been a Kaizen assessment that has been administered annually with the coalition, which had several different components in it. And one example would be at our prescription take back, we implement a 5-question quick survey to gather information about prescription drop off and use in the city of Meridian. So that's one little example of a measurement. And so between that and several other surveys and the annual Kaizen and the annual MADC satisfaction survey, we want to see if there's gaps that we need to fill in those assessment processes and surveys, and then also if we can streamline so that we're not duplicating efforts with any of those. So as we move forward and there's a little bit more planning that takes place, we will then come back and share that hopefully in more clarity. That's the goal with the coalition as well. And I'm happy to send you some information on that as well, Milt.
Thank you, I appreciate it.
You bet, of course. Brenda, do you want to go ahead and give a little update on what we've talked about as well?
Sure. So I'm returning from last year, and one thing that I've noticed is that there's been other opportunities for a way for the coalition and for other boards or other community involvement to kind of come together and help each other out. So I'm on the Region 4 Behavioral Health Board, as well as part of the Suicide Prevention Coalition. And so what I will be doing, and you guys are always welcome to email me, or if this is the correct forum to share some information or some questions, I will be reporting back after our meetings, their monthly meetings, and let you know what's happening in the community with regards to at least those two that I'm involved with, and then bring things back to those meetings that we have here for the Meridian Anti-Drug Coalition. I know that suicide and drugs, they coincide, and so I think it's a real helpful place to be able to share information back and forth as to what we can do to try to alleviate that issue. So again, you guys can reach out to me, and I'll be taking notes and then bringing it back to the meetings as I go each month.
Excellent. Thank you, Brenda. And just so that people know, the Region 4 Behavioral Health Board has been in place for quite some time. And they have a monthly meeting as well. And then the Suicide Prevention Coalition has been newly formed, and they're working off of a state plan. And so they're in the beginning stages. So it will be helpful as Brenda's out in the community so much that to bring that information back, and I'll stay up to date on that as well, but it really helps to have another voice in the room to help facilitate that communication back and forth. So thank you for that, Brenda.
You bet. I just think it's great that there's even more places that we can now share our message here at this coalition. Getting bigger.
Definitely. I love it. Thank you.
You bet.
Does anybody have any question or comment regarding that?
I do. This is Milt again.
Hi, Milt. Go ahead.
Now, Region 4, what does that cover?
So
go ahead, Brenda.
The Treasure Valley, we have Mountain Home. It goes kind of out towards Mountain Home, and then back down like around Cascade area. There's different. I can send Kendall a regional calendar or a map that shows where each of the regions fall in terms of boundaries and what cities. Like Nampa, Meridian, or Nampa and Caldwell is part of Region 3, so it's like Meridian, Boise, and further east.
This is Courtney from, oh, pardon me. This is Courtney from Central District Health. So Region 4 consists of Valley, Elmore, Boise, and Ada counties. We're defined by the Idaho Department of Health and Welfare and state regulations for our region based on our public health district. And the Suicide Prevention Coalition is also working on regional efforts as well, but we're applying that statewide plan. Sorry to interrupt you there, Mel.
No,
Yeah.
and thank you for clarifying that. It's much easier how you said it than what I was trying to draw a map in worldwide virtual reality. Sorry about that.
It's all good, Brenda.
Yeah, this is Mel again. Do you have any affiliation or any connection with the VA Medical Center?
So I'm also part of Joining Forces for Treasure Valley Veterans. So that is partly part of their services come in, and we have people, representatives from that meeting or that service that comes to that meeting as well.
Okay, good. Thank you.
You bet.
Good conversation. Thank you for the input and information. All right, next we have Lieutenant Shawn Harper. We welcome him. This is his first time, as he said. He's new to the sector rep position, and he's the new supervisor over community services. So we'll let Shawn introduce himself and share what he's working on.
Well, thank you for having me. So I've been involved with the youth with the SRO program for a number of years. Also working out in the community with our nonprofit. So youth safety in all aspects has always been something important to me. So now with MADC, it gives me an opportunity to connect with a lot more people focused on prevention and helping not only our youth, but anybody that's potentially going down the wrong path or needs help or wants to learn. So I'm excited for that. I'm also part of the Governor's Juvenile Justice Commission, which again correlates with prevention. And I was actually looking at some stats recently from a report I got, and here in Ada County they work a lot with the diversion program, which again falls right into trying to get kids to be on the straight and narrow and start making good decisions and stay away from drugs and alcohol. And they've actually started to see a decline in the number of youth being on that diversion program, and a significant decline of kids incarcerated in the juvenile system. So we're seeing a lot of good things on the back end. Obviously with MADC, the focus is on the front end of trying to prevent our young people from making these poor life choices that could lead them into another system. I'm also working with the SRO still with a new program called the JET team. It's a juvenile enforcement team, and they are out in our community. It's all the SROs from the schools working together during the summer months, keeping an eye on our problem children, but also interacting with our youth in the parks and at events, working with families throughout the summer, so that we're getting a 365-day coverage of the youth in Meridian. So there's a lot of good things going on. I'm excited to work closer with MADC and with Kendall. She's not far away. She's just downstairs, so I see her quite frequently. So thank you for having me.
We appreciate your leadership. Thank you, Shawn.
Can I ask a question?
Of course you can, Milt.
Hey, Shawn, do you have any connection, or do you have any work dealing with the Veterans Drug Treatment Program in the areas?
I don't. I know with our crisis intervention team and some of our folks down on patrol, they work pretty closely with our veterans in regards to mental health as well as substance abuse. But I don't directly have any links, unless there is some link between their children potentially and us.
Milt, this is Brenda. Joining Forces for Treasure Valley Veterans has a representative from the agency that you just spoke of. That, if you'd like, I can send you some information as to when they meet. That might be something that would be interesting for you to come and visit.
Yeah, I'd like to do that. I'm a veteran, also a veteran service officer. I've been doing this for years, and I know they started this a while back, and it's beginning to be quite successful. And we look at suicide that was earlier mentioned, and there's a high rate of suicide in veterans. And this is these veterans, this is maybe their last opportunity to get themselves cleaned up. And sometimes they come out of there and they're just like when they come out of the correctional facility. If their friends are out there, their friends are going to connect with them, and they may end up infecting others. I just wonder how the coalition is kind of working, if we are working with these groups.
Well, I will connect with you later on this afternoon, and that I would love to talk with you some more. That would be great.
Thank you very much for your time. You too, Shawn.
You bet.
Excellent. Thanks for the collaboration there. It sounds like we'll get a good connection with some veteran services and support between Milt and Brenda in sharing that community information. So next up, David, welcome to MADC's executive committee and serving as our sector rep, and he has already been busy. So if David, you want to introduce yourself and give a little update and ask any questions that you might have of the membership for feedback on what you're working on.
Yeah, so thanks, Kendall. So I am the new media sector rep, and I come with a lot of knowledge in this area as working as a social media marketing consultant for the last 9-10 years, and a lot of that has to do teaching clients how to create content for their different business, organization, or group, and has built this has given me an opportunity to build quite a portfolio of contacts when it comes to getting messages out as well. I worked for the last year and a half as a beat reporter for local newspapers down in Southern California, where we moved from. What Kendall and I have been working on, I saw something that the Canyon County Drug Free Coalition did with Valley View High School in recording a series of videos on vaping when it comes from the perspective of two teens who had been using an educator, someone in law enforcement, and then someone from St. Luke's, I believe, on the medical side, but basically informational videos talking about vaping and the dangers and some of the things that we know factually can be pitfalls for that. And the most eye-opening for me was the youth, because they were just so truthful and how it affected them personally. They had both been former vapors themselves, and how they fell into it and what it meant to them and how it affected their lives. And so what Kendall and I talked about is creating some substance abuse topic related videos for MADC, primarily focused around the city of Meridian and what we're going through. And we started last week. Kendall and Cole sat down and talked about not only how drugs and substances are affecting our youth here in Meridian, but also the benefits of having youth in the leadership roles in your coalition. So he got a chance to tell us some of the things that how being a part of MADC in a leadership capacity, how that helped him. So I actually just started diving into those, to the editing of those today, and I should have something for Kendall next week, and she can choose how we're going to disseminate those. But what I need from the coalition is, I need anyone who has a story, or anyone who has any kind of perspective. I mean, Shawn, I think you would be a perfect person for this, as much as you not only working in law enforcement, but working with our youth who might be, falling down a troubled path with the new opportunity you find yourself with the governor. But we're just looking for different perspectives that we can show people, because one of the scary things that I came across as I was just kind of digging into this new opportunity was that there's a poll out there that 73% of the people in Idaho support marijuana legalization in the state, And I find that very hard to believe, talking to people in my neighborhood, nobody really seems super excited about legalizing marijuana. So I got to think they found 73% of the people maybe in Boise. I don't know. But so I really want to start showing people real perspectives on what drug and alcohol, and it's not just marijuana. My wife is a teacher at Centennial High School, and they deal with a lot of vaping issues there, and the kids aren't just vaping vape juice, they're vaping other substances too. So some of these things intersect in ways that we don't know. And then I even got a chance to sit through a webinar with Jermaine Galloway, the tall cop, and he talked about all of the ways that kids are hiding their substance abuse in the classrooms and stuff. So there's information that I feel like we need to get out. And so if anyone has any expertise and they're willing to sit down and kind of document their knowledge, I'm for it. And Kendall and Cole can both verify that it was very painless and that the camera did not eat them alive. I even turned on a light and scared them at the last minute. They didn't even know what it was. They're like, ooh, lights and camera. So I'm very good at making this as painless as possible and just getting the information. And even if you're nervous, we can make you look unnervous on camera. There's a lot of magic we can do with cameras.
Excellent. Thank you, David. We appreciate your expertise and your passion behind the work that you're doing with the coalition already. So next up, I would like to just provide a little update. I've been in touch with Terry. She couldn't make it to the meetings today, but she did reach out via email. And last year, at the beginning of the school year, she had reached out, and throughout the school year, she had reached out to the PTA and PTOs, starting with the middle school, knowing that that is when youth are usually first exposed to some of the choices regarding drug use. And so she's going to continue to do that, and she's going to reach out again. And also, as I mentioned at the beginning of the meeting, enhancing our use of Facebook and going out and finding all those PTAs and PTOs that have a Facebook page and being active there as well is something that we're already working on. And then also she's going to reach out to the elementary schools and really just kind of expand our outreach and help make sure that they know that the resources that we have available, and hopefully then through some of these new videos that we're working on, we'll have some great locally created tools that the schools and the PTA and the parents can use. So, and we thank Terry for her continued work. She served as the parent sector rep last year as well. Milt, I'm going to move to you in just one sec, but since I'm already talking and Dawn's not with us today, I'm just going to let everybody know that I have been working with her to secure 50 new drug-free school zone signs for West Ada School District. So we're in the process of working on that. She put out a poll to staff members, and those were the requests that were made. We already have the sign existing on many of the campuses throughout West Ada, but there's an increased request for some more, and when they start to fade or they're not legible, we replace them. So we're working on that. And then also I've been working with her and the committee that has been working on updating and revising the West Ada School District drug policy. And that was what they went through before the board last week, I think, or the week before for the third time. And there's just one more revision that the Board of Trustees is hoping for. And then that will have gone through that final process as well. And then also she ran a Vape Psa Contest and had asked me and some others to serve as judges for that. And they had over 20, I think almost 30 contestants submit PSAs, and they selected the final winners. And we've posted that on our Facebook and shared that post from West Ada School District. So she's been super active and busy. And as we transition through the summer, sometimes Dawn and or Jeannie, who will help share that position as school sector rep, are unable to make some of those summer meetings. But just know that as we transition into the 2020-2021 school year next year, Jeannie Bouchine will be then stepping in and filling that shared role of school sector rep. So now, Milt, I'm going to turn it over to you just to introduce yourself. We're happy to have you and recognize that you're new as the sector representative and really kind of getting your feet on the ground. And you can go ahead and unmute yourself and give us a little introduction.
Well, thank you. I'm happy to be here. Actually, the way I got into this was Cheryl came up to me one day and gave me a piece of paper and told me to sign my name at the bottom of it. And I thought I was entering in a raffle. And that's where I'm at. But actually, the faith sector has an interest. That being, I think I mentioned before that I believe that the family is a basic element of our society, and how goes our families, so goes our society. And reaching into the churches and other faith-based units to the kids also, I think, has an opportunity to reach their parents as well. I know that I had a chance to talk to Mary here a while back, and she said that she had called many of these organizations and hadn't had a lot of success in getting a response. She'd left their telephone number and hadn't been too successful in that. And in this letter that you and I talked about that she mailed out in August of last year, apparently there hasn't been too much return on that. So with the way things are right now, I'm more of somebody that would like to look somebody in the eye and talk to them rather than talk to them on the phone, because it's easier to put somebody. You've always got a gatekeeper out there in most of these organizations, and it's easy to pass that on to the gatekeeper to take care of it, which is, yeah, we'll get back to you. One of the things I think that might work, and especially in the environment we're in right now, Kendall, is what you had mentioned to me in the letter, and you mentioned it earlier about this, be the parent and these packets. And I actually, I sent an email to the folks in my church, the youth director and the children's director, and give them the website that you've given me. And I did get a response back from one of them that said, I would really like to look at that, but I don't have the time right now. So what I would like to do is, once they have that opportunity to look at it and also to get the packets and see what they can do with them, their success in it, then that give me a bit, I think would give me a better opportunity to be able to reach into another tool to reach into the faith-based units and to talk to them about that. So that's where I'm at.
Excellent, Milt. We appreciate it. We're happy to have you with us. And I think you're right. I think you're on the right track, and that's a great resource and it kind of a segue to start some of those conversations. And we'll keep in touch and we can get some actually printed documents and paper once we get those, and so that you have those in hand if you prefer that method as well. So there's lots of different opportunity. So thank you for that.
Thank you.
Next, we have an update from Nicole, our returning substance abuse sector rep, and she's been with the coalition for many, many years, and is working on some right now brainstorming before we actually implement ideas for interactive prevention booth activities. As our natural high booth, we still use it, but we've had some requests for some new interactive and exciting booth activities, and so she's been putting out some ideas on that. Do you want to go ahead and give a little update, Nicole?
Yeah, so we just had some ideas that we were tossing around in the past, because I've been with MADC for 10 years now. And when we first started, like, we had colorful buckets, and then we had a wheel that had different colors on it. And we used to have the kiddos spin the wheel, and whatever the color landed on, they would get merchandise or a treat or candy or something from one of the buckets. And as they were spinning it, we would ask them questions like, what do you say if someone offers you a cigarette, and things like that. So option one, we could bring that back. Option two, we could do a beanbag toss, where they would stand on one side of the table and try and toss it into where the beanbags go. And if they made it, then they would win a prize. And kind of along the same lines, we ask them questions or give them fun facts. Another one was if we had like a Velcro, like a large Velcro board, and if they threw the fuzzy ball and it stuck to the Velcro, depending on what section, they would either learn a fun fact or a stat regarding wherever the ball landed, whether it be like drugs or pills or alcohol or vape or something along those lines. That could be fun, kind of interactive, where they're throwing And then my kiddo, she's 11, and she had an idea of having like 3 laminated photos of bad drugs and 3 laminated photos of good drugs. And then the kids, the younger kids, would have to pick which ones are good and which ones are bad. So like alcohol, marijuana, cocaine, those would be the bad drugs that would go in like a little mini trash canister things. And then the good drugs would be like Pepto-Bismol, kids Claritin, or kids like cough syrup or something to kind of differentiate for the kids. Like when we say drugs, what do we mean? You know, there are good drugs and there are bad drugs. But these are just brainstorming activities. But I'm willing to help make any of these a reality if and when I can.
Excellent. Thanks for the update. And if anyone has any additional ideas that they'd like to add to that, feel free to enter that into the chat box or reach out to us or Nicole. And then as we narrow down which activity we think would be best with some input from our new youth sector rep, Jamie, then we'll start to implement that and put that together. So thank you, Nicole, for working on that. Next, we have Cole, our youth sector rep, our outgoing youth sector rep. This will be his last meeting with us. And really, Jamie is taking over as the youth sector rep. And so I'd just like to take a moment to say thank you to Cole for his leadership over this last year and up until like working straight through and filming video footage last week. You've done a fabulous job, Cole, and we definitely wish you all the best in your next endeavor. Don't be a stranger. Keep in touch. If there's anything that you need from us, if you need a letter of recommendation from me, please reach out. And thank you again. And then to Jamie, we welcome you and we're excited. And if you just want to kind of introduce yourself and maybe give us an idea of what you think you might be interested in. And if you don't know yet, that's okay too. But that'll help guide us in helping you be successful in your leadership position. So Jamie, go ahead.
Hi, I'm Jamie Perry, and I go to Renaissance High School, and I am really interested in working in like the events that Meridian Anti-Drug Coalition hosts, as well as like where we go. Like I know in the past I've been at some of the Meridian Anti-Drug Coalition when they either come to my school or I'll just be at a community event where there'll be like a Meridian Anti-Drug Coalition booth. And I think that that's something that I want to be involved in, as well as definitely working with high schoolers, middle schoolers, elementary kids, like that demographic, in helping prevent drug usage.
Excellent. Sounds great. So thank you for being with us, and we're excited to have you in the sector rep role as the youth sector rep. So thank you, Jamie. And Earl, I was just wanting to check in with you and see, Earl did a lot of work to put together. Those were the first events that we were coming right up on when we had to start canceling stuff. We had a lunch and learn where I was scheduled to go speak and present at Holy Apostles. And then we had a partnership formed to do a mobile take back for their parish. And of course that got canceled. So I just wanted to check in, Earl, and see if things are starting to, or plans are being made to kind of go back to the normal, if you've heard anything, and maybe you haven't yet.
They are trying to go back to normal a little bit. It's going to be a real slow process because of the social distancing, but I'm hoping we can get a take back before the end of the year. Because they really want a place for the older people to be able to come and not have, because a lot of them don't get out more and just go to church or something like that.
Right.
Other than that, I just want to let everybody know, even though as for Holy Apostles, they come to me for anything law enforcement related, even though I'm no longer a law enforcement officer and I'm sort of their contact person, but I am there to help any of the youth services or serving organizations. I'm there to help the new youth representative and wherever they need help with. I've been with the organization for some time as both a police officer with Meridian and now with public safety here at ISU. So if there's anything that we can get out there to help them with, we will do that. And I even try to get our pharmacy students and PA students to get involved too.
Definitely. Yeah, we appreciate your longtime service over the years and the different capacities that you've helped us out. So we appreciate that very much. So as I appreciate all the sector reps giving an update, and it's a little bit of a transition phase as we have incoming and outgoing leadership roles, and we've been doing our strategic and action planning. And so now that we've kind of laid out a little bit of a plan and identified what we want to work on, we're going to move forward. And so there'll be opportunities to expand our partnerships and help fill those gaps as we implement the strategies. So we're looking forward to that, and we're excited. A couple little tidbits of homework that I would like to share. We have, as I mentioned, been working on our Facebook. So just a reminder one last time to send us a little email or in the chat box ideas for different organizations or partners that we should like or follow. And then sharing the Be the Parent resources, the activity sheets, and 30-day parent challenge. There's other resources available on that website, or you can go through ODP's website. And so just reminding you that those resources are available, and there's more to check out than just the two that I had mentioned today. And you can request those be sent directly to you or your organization right on their website. So reminding you of that. And then also the marijuana report is a great source of information as we look at the ever-changing world of cannabis. And so I suggest that you sign up for their newsletters. That's up to you, of course, but that's one of the newsletters that I get that helps keep me educated and up to date on what's going on with policy across the nation. And then as we look at wrapping up, I just wanted to double check and make sure if anyone else, I know I just checked with Sarah and she said there were no additions in the chat box. So one last check to see if anybody has anything to add. Okay. Well, I appreciate everybody being here, and if things go as planned, we will meet back in person. June 18th will be our next meeting, and I appreciate all the commitment to prevention, and I have a great long weekend if you get to have a long weekend for Memorial Day, and we look forward to seeing you in June. The recording will be available by the end of next week. So thank you, everybody.